this fall, a wise thing to do, everybody should get a flu vaccine this fall.
Without question, the single most important thing that can be done this year, get your flu vaccine. The flu vaccine is produced in a fashion to help it fight the strains of influenza that are expected to come out in that coming season. The flu vaccine for the fall is going into production now, and so when the fall comes, it's critical that everybody get vaccinated to prevent the serious spread of infection.
There's also a possibility they might make a special one or two other flu vaccines. As they get more information on this and they feel it's a problem, they might come up with something they might need an additional vaccine for. Is that true?
That is true. Normally, the flu vaccine covers the three most common types of influenza that are expected in the year coming, and it takes roughly 6 to 9 months to produce a flu vaccine. This year, the flu vaccine production was started when we were hit with this newer H1N1 flu. And so for the coming year, we may end up with 2 vaccines, one for standard flu with an additional one to cover the H1N1 strain.
Like most vaccines, you give 1 or 2 shots, you cover flu. How come the flu can't you just make a vaccine and that's it, one time?
Well, the problem with the virus is that it mutates every year to some degree. And so we need to give a new flu vaccine every year in order to cover the expected viral strains that are going to come through the community on a yearly basis.
We have 2 forms of flu vaccine, one by injection, one by a nasal thing. Which is the one that you prefer?
Well, the nasal flu vaccine, the FluMist, does have certain advantages that I like. One, being given in the nose rather than by vaccine is easier. It's easier for the patient, certainly doesn't hurt, and it's a quicker approach. The second is that since the nasal flu vaccine contains the entire viral particle in a totally inactivated fashion, the viral particle would actually give us, in theory at least, better protection for the flu since it includes other targets for our immune system to fight. Whereas the standard flu vaccine contains the H1N1 but doesn't contain, or the HN of the other strains if it happens to be a different strain rather than H1N1, but it doesn't contain the whole viral particle, and so it's missing other portions which may help our body fight infection.
Are there any complications to using the nasal version of the flu?
Not really. The complications really relate to the same complications of the flu virus vaccine itself. So both the nasal and the injectable form of flu vaccine have essentially the same complications, with the only difference being the lack of a needle and the complications related to the needle itself.
What is the youngest age you can give the nasal form of a flu vaccine?
The youngest age approved at this point is 2 years old. There's not sufficient data for children under 2 to be given the nasal vaccine, and at this point the FDA approval for the vaccine is in patients that begin at the age of 2.
If they have some immune-compromised condition, they don't recommend it?
Just like with any type of active vaccine, if they have an underlying immune defect of some fashion, then you should only use the vaccine with extreme caution. And since there's an injectable form that's less risky, the general approach is to give the injectable form rather than the nasal form in those types of patients.
And the injectable flu is made from egg?
It's cultured on eggs, so there is a small amount of egg protein within the vaccine itself, and if the patient has a documented significant egg allergy, that would be a contraindication for both vaccines.
So you should sit down and discuss with your doctor if you want to get a flu vaccine, what type of flu vaccine. But also, if we take care and reduce the number of common flu cases, if someone comes down with severe flu symptoms, we have a better chance that we can target that patient in a selective type of situation?
Absolutely. Vaccinate, 1, minimize exposure, 2, take proper precautions with hand washing, 3. Those are the 3 key features to controlling this problem.
And also stay calm, don't overreact. and the people who run the public health services in the cities and on a national basis right now are doing an excellent job. But remember, hindsight's best sight. So there may be some mistakes made. We can do a little bit better, but they're really trying to do a very good job and trying to control it. Is that true?
I truly believe that. Staying calm, listening to what our public health officials tell us is really the most important thing we can do. They have the most up-to-date information. They have the most accurate information, and they don't keep that information from us. We are getting information perhaps even too fast, because sometimes information we get on day 1 might change by day 10 as we get newer and more accurate information in. So listen to the announcements as they come through, follow the recommendations that public health tells us, and ultimately this will be just another epidemic which will pass and we'll all be just fine.